Assalamu alaikum. Now I would like to discuss about psychoactive drugs, drug intoxication and withdrawal. Psychoactive drug intoxication and withdrawal. Alcohol is GABA receptor positive allosteric modular, inhibits glutamate induced excitation of the NMDA, inhibits glutamate induced excitation of the NMDA. It's a non-specific mood elevation, decrease anxiety, sedation, and behavioral disinhibition, respiratory depression. There is emotional lability, slurs, speech, ataxia, coma, and blackout. Ataxia, coma, and blackout. AST value is 2 times than ALT value. Treatment is supportive, fluid, and antiemetic. Non-specific anxiety, tremor, seizure, insomnia. Adaptation causes increased glutamate receptor. Symptoms result unregulated excess excitation. Treatments longer acting benzos can be given from 3 hour to 36-hour tremor, insomnia, diaphoresis, upset can happen. Withdrawal starts at 6 hours up to 48 hours. Alcoholic hallucination usually starts after 12 hours up to 48 hours, and delirium tremens after 48 to 96. After 48 to 96. So delirium tremens happen after 2 days. After 2 days, tremor starts at 3, withdrawal starts 6, and alcoholic hallucination starts at 12. So 3, 6, and 12 reaches up to 48, and delirium tremens start at 48. Barbiturate, increased duration of the chloride channel, GABA A receptor positive allosteric module, barbiturate, increased duration of the benzodiazepine, increased frequency of the chloride channel, barbiturate, lower safety margin, mark respiratory depression treatment, symptom management, and assist respiration, increase blood pressure. Delirium, life-threatening cardiovascular collapse can happen. A benzodiazepine treatment is flumazenine benzodiazepine receptor antagonist, seizure, sleep disturbance, and depression. Opioid receptor modulator, opioid receptor activation of the mu receptor causes prototypic effect of the meiosis pinpoint people, GI motility, respiratory, CNS depression, euphoria, decreased gag reflex, seizures. Most common cause of death in drug overdose. This is the most common cause of death in drug overdose. This is very high yield, and overdose treatment is naloxone. Overdose treatment is naloxone. Okay, inhalants enhance GABA signaling. Inhalants is inhaled GABA signaling. Disinhibition, euphoria, slurred speech, ataxia, disorientation is seen. Disorientation, drowsiness, periorifacial rash can be seen. In inhalants, enhance GABA signaling. Inhalants, you have to remember the D and I. What does D I E? Die. In inhalants, when you take the inhalants, you have to die. What does that mean? D on E. Disinhibition, disorientation, and drowsiness and euphoria. These are the things you have to remember. Dysphoria, disinhibition, drowsiness, disorientation, disturbance in the sleep, all the D's and I, irritability and E, euphoria. Inhalants is all about die. In amphetamine, there is mood elevation, decreased appetite, psychomotor agitation, increased heart rate, and anxiety. Meth mites, tactile hallucination. In meth mite, there is tactile hallucination. Meth mites, there is tactile hallucination. Before jumping into this, in opiate, there are some withdrawal. In opiate withdrawal, there are some problems may happen. Mydriasis, opiate causes meiosis, and withdrawal causes mydriasis. And there is diarrhea, flu-like symptom, yawning, nausea, sweat, bile erection, also known as cold turkey, and lacrimation may happen. So increased secretion and all the dilation can happen in opioid. Symptom management, methadone and buprenorphine. Acute overdose is naloxone. Overdose treatment is naloxone, but withdrawal is methadone and buprenorphine. Inhalants can make you die, disorientation, disturbance in the sleep, uh, dif- uh, disturbance in the sleep, disinhibition, disorientation, irritability, euphoria. These things happen in inhalants. And in amphetamine, it also causes euphoria, grandiosity, mydriasis, prolonged wakefulness, hyper alertness, hypertension, paranoia, fever, skin excoriation with methamphetamine use, severe cardiac arrest, and seizure. Treatment is benzodiazepine for agitation and seizure. Treatment is benzodiazepine for agitation and seizure. Post-use crash, including depression, lethargy, increased appetite, sleep disturbance, vivid nightmare may happen. Amphetamine induces reversal of monoamine transporter VMAT, DAT, SART, NET, and increase neurotransmitter release. It increases neurotransmitter release. So amphetamine causes euphoria, causes grandiosity, causing mydriasis, prolonged wakefulness, hyperalertness, hypertension, and paranoia. Caffeine is adenosine receptor antagonist. Adenosine receptor antagonist. Palpitation, agitation, tremor, insomnia. Palpitation, agitation, tremor, insomnia. Headache, difficulty concentrating, flu-like symptom. Cocaine block reuptake by dopamine, serotonin, and norepinephrine transporter. Cocaine block reuptake of dopamine, norepinephrine, and serotonin transporter. impaired judgment, mydriasis, diaphoresis, hallucination, paranoia, angina, sudden cardiac death. Chronic use may lead to perforated nasal septum due to vasoconstriction and resulting in ischemic necrosis. Treatment is benzodiazepine. In cocaine, withdrawal treatment is all the benzos. Restless hunger, severe depression, sleep disturbance. Restless hunger, severe depression, sleep disturbance. And in nicotine, stimulates central nicotinic acetyl receptor. Restlessness can done and withdrawal causes irritability, anxiety, restlessness, decreased concentration, increased appetite, nicotine receptor. When therapy, patch, gum, lozenge, bupropion, and varenicline. LSD is perceptual delusion, visual and auditory delusion, depersonalization, paranoia, psychosis, flashback, and mydriasis. In there is all LSD, there is P, perceptual distortion, paranoia, and some sort of mydriasis and flashback. From mydriasis, 5-HT2-1 receptor antagonist, cannabis or cannabinoid. It also causes paranoid delusion, perception of slowed time, impaired judgment, social withdrawal, increased appetite, dry mouth. Cannabis causes dry mouth, hallucination, euphoria. MDMA also causes euphoria. In MDMA and ecstasy, there is a bruxism, distorted perception, mydriasis. In these two cases, cannabis, uh, LSD and MDMA both can cause mydriasis. In MDMA, there is bruxism, but in LSD, there is no bruxism. Paranoia, psychosis, and perceptual distortion is seen in MDMA. Depression, fatigue, change in appetite, difficulty in concentrating, and fancy causes nystagmus, violence, impulsivity, psychomotor agitation, hypertension, analgesia, psychosis, delirium, and seizures. Alcohol use disorder, thiamine can be given. Alcohol use diagnostic criteria for substance use disorder, complication, vitamin B1 deficiency, alcoholic cirrhosis, hepatitis, pancreatitis, peripheral neuropathy, testicular atrophy. Treatment in alcohol use disorder, naltrexone, reduce cravings. Avoid in liver disease, acomprosate. Evidence in renal disease, comprosate. Evidence in renal, naltrexone, evidence liver, disulfiram. Uh, to condition the patient abstain from alcohol. Support groups such as Alcoholic Anonymous are helpful in sustaining abstinence and supporting. Wernicke-Korsakoff syndrome, there is vitamin B1 deficiency, vitamin B1 deficiency, Wernicke encephalopathies, confusion, ophthalmoplegia, and ataxia, and may progress to irreversible memory loss, confabulation, personality changes, which is Korsakoff syndrome, IV vitamin B1 before dextrose, triad, confusion, ophthalmoplegia, and ataxia is Wernicke, and if it is memory loss, confabulation, and personality changes, it is Korsakoff. And mm, and that is all about the psychiatric emergencies And that is all about the psychoactive drug intoxication and withdrawal. Hope you enjoyed.